everyone, it's Yaz from Yorkshire Peaches Therapies and welcome back to my channel. On today's video, we're going to be doing something a little bit different and we are going to have a look at a very new research paper that has just come out about a drug called Librela. Now, Librela is going to divide any room whenever you mention it, but before I kind of get started about this, just to say, I'm not a vet. The only person that can be discussing dosage and pharmaceutical intervention and diagnosis or anything like that is your vet. I am a canine wellness consultant and I specialise in pain management. So this is something I get asked a lot about. I'm also painfully dyslexic as well, so apologies if I make any errors whilst reading this. I am not a scientist, I am just a very keen therapist who is desperate to learn things all to do with pain management. So there's some parts of this paper that I can't grasp, but I'm going to talk about the things that I can grasp. So before I kind of jump into this paper, I want to tell you a little story. So last year I went to VOCON, which is the Veterinary Osteoarthritis Convention. And there was an absolute heap of lectures and it was really good to kind of bump up my CPD and network and yada yada yada, all that good stuff. Now, one of the lectures I went to was about Librela. And it was delivered by one of the creators of Librela. And with that lecture, the way that Librela was kind of packaged up and sold was that it was the new NSAID. This is a new NSAID. So an NSAID is your non-steroidal anti-inflammatory drugs. That's things like Loxicom and Metacam, things like that. And they are very effective pain relievers for musculoskeletal pain. So it's a combination of an analgesic, so that's your painkiller, and then an anti-inflammatory as well. Now, people can sometimes get scared about using pharmaceuticals. Now, anyone that knows me and knows this business knows that I am very passionate about natural health for dogs. However, I do have a really big appreciation for pharmaceutical intervention as well. It's not one or the other. It's about a holistic approach. And utilizing everything that's available to us. Now, NSAIDs, we have known for a very long time that there is risks associated with it. But who was it? I can't remember who said it. There's no such thing as side effects. There's just effects with drugs. So that can be positive and it can also be negative. So with your NSAIDs, the three big ones is that it can cause liver and kidney damage. That's for long-term use. And also it can cause digestive upset. So if you have a dog that has got a history of gastrointestinal upset, so dicky tummy or anything like that, they may be extra sensitive to those effects of NSAIDs. So it's always worth just mentioning to your vet if your dog has digestive upset. Now, NSAIDs do get a bad kind of name for themselves because of that digestive upset, but more so for the liver and kidney damage. This is something I see a lot in the natural community. But what I would say is, with any kind of conversation with your vet about pain relief, is you're balancing it up. Every dog's going to be an individual. Now, if you have a 14-year-old dog, for example, that's had blood tests and their liver and kidney values are A-OK, then to make sure they're comfortable and as pain-free as possible, for me, is going to be more of a benefit because it's not going to be liver or kidney disease that potentially leads you to do an elective euthanasia. It's going to be lack of mobility or, that inability to control pain anymore. Again, I can't tell you what to do. It's your dog, your decision, but it's something to be thinking about. So anyway, let's jump into this paper. Let me just move me out of the way first. Okay. Right, I'm going to go over here. Okay, so this paper is super spicy. Now, when I was at VOCON and I listened to this lecture about Librela, I was really disappointed because the chap who gave the lecture, when he was asked questions about Librela and these adverse effects that were happening, they were kind of like really wishy-washy kind of politician answers, and I was like, oh, okay, that's yeah, I'm not vibing with that. But the main thing that kind of concerned me, that there was a little mention of what has been happening in the human medicine field. So in the human medicine field, the human equivalent of Librela was used, I think it was for 10 years, with people who had knee osteoarthritis. And what they found is something called joint trashing occurred. So basically, if someone can't feel pain in a painful area, they're going to use that limb as normal and go over their, exercise threshold, because there's no reports going to the brain saying, oh, you should probably stop doing that because that's hurting. So it never kind of came into fruition in human medicine, because joint trashing is not good, okay? So I said to there was a lady sat next to me who was, she was representative for a drug company, but also a vet, and I went, why are we not talking about the joint trashing that occurred in humans? And she's, well, that's humans, this is different because it's dogs. And I went, well, why are we cherry picking what research we should and shouldn't be looking at? I'm very curious, and I ask a lot of questions, and I genuinely couldn't understand why we weren't looking at that. And I left Vocon honestly feeling a bit deflated. I went wanting to learn more, and I did learn more, but I was like, oh, this is all a bit muggy, and I don't really like it. Now, I've seen Librela do really wonderful things in my pain clinic. I have seen dogs who, we were having whole cocktail of pain relief, but the arthritis was so advanced, our cocktail of pain relief and therapy and all the kit and caboodle wasn't cutting the mustard anymore. But then that dog had Librela, and we got another 6 months, and now they were good. They were a good 6 months that we had. So I've seen it do amazing things. I've also seen it do really shit things as well. So one, this is obviously all anecdotal, but I've seen dogs become itchy, like inconsolably itchy on Librela. You only have to go in there's a Facebook group about adverse reactions from Librela, and there's dogs that are losing their lives now. Again, these are going to be anecdotal cases of people kind of coming forward and saying, this is what's happened to my dog, and there's other things we have to take into consideration, like what other pathologies did the dog have? So what other problems did the dog have? Was it just a coincidence with the Librela that these things happened? I don't know. Jury's out on that at the moment. For me, in my humble opinion, I think the way that Librela has been prescribed is absolutely, it's just been given out willy-nilly, for want of a better word, with the way it was packaged up in a lecture that I attended, as it been the new NSAID. GP vets aren't to blame, I don't think anyone's to blame apart from the creators about the way it's been prescribed. Vets have 10 minutes in an appointment, right? You go in and say, my dog's painful, help me. That vet does not have time to go through all the differentials of, okay, is there rugs down in the house? Have you considered, your dog needs to lose weight? All of those things, they're so limited on time. You go with a problem, the vet goes, I've got an injection that'll fix that. And the dog's pain free. And I think it only works in about 80, I say only, it works in about 80% of dogs. And obviously there's cats as well with the is it Silencia, I think? Which is like the cat equivalent. Now, it's really tricky, because we kind of get into a muggy kind of ethical conundrum of, okay, we've got a dog that's really, really painful. I'll just give it a shot of Librela and it'll be that, tick, done. But actually, what are the consequences of that, especially young dogs being put on Librela? In my humble opinion, Librela should be... So I always explain to people, it's like a ladder. So on that ladder, you've got things like, I speak from like a human perspective. So you've got a headache. First thing you've got is go and have a drink. You're probably dehydrated. The next thing is, okay, have some paracetamol. The next thing is an aspirin. But then if it's not working, you kind of creep up that ladder. So if we change it for dogs, we've got things like paracetamol, then you've got your NSAIDs, and you've got like your GABA, then you've got your really kind of like heavy hitters, you've got your tramadol. Librela should be right at the top, not the first point of call, in my opinion. But anyway, let's have a look at this paper. So this paper is musculoskeletal adverse events in dogs receiving Librela. This is public access, open access. You can access this on Tinterweb. Now, with the people that have done this review, so there's some really kind of like heavy hitters in here from the canine pain management osteoarthritis world. So you've got Mike Farrell in there. You've also got Louise Clark as well, amongst all of these heavy hitters. But basically, you've got the right people on board to be having this conversation. So with the objectives, they wanted to have a look at the adverse events of Librela compared to 6 competitor drugs, and those drugs were Rimadyl, Metacam, Previcox, Onsior, Galliprant, and Daxocox. I've not heard of that one, but all of the other ones, they're pretty kind of like bog standard non-steroidal drugs, and they wanted to have a look and see what the crack was. So the conclusion... So this study supports recent FDA analysis by demonstrating an increased reporting rate of musculoskeletal adverse events in dogs treated with Librela. Further investigation and close clinical monitoring of treated dogs are warranted. The amount of dogs that are on this drug is huge. It's absolutely huge. And our findings should serve as a catalyst for a large-scale investigation. Yes, it should. So, right, okay, let's have a look at introductions. It talks about osteoarthritis is the most prevalent chronic pain condition in companion animals and is a significant contributor to reduced quality of life and premature death. Sorry, my camera's... Let me just stick me over here for a second. Quality of life and premature death, so that's elective euthanasia. Although a diverse array of therapeutic approaches are currently available, all possess limitations, including suboptimal efficacy and the potential for severe adverse reactions. Everything has its limitations, especially when it comes to pain management. Sometimes the pain gets so big that actually nothing can touch it. But again, when we're talking about pain management, there's not just one silver bullet. And anything labelled a wonder drug or anything like that, beware. Okay, so chronic pain management is challenged by the trade-off between safety and efficacy. Absolutely. Analgesic drugs that provide significant pain relief can carry a higher risk of adverse reactions than safer, less effective options like glucosamine chondroitin joint supplements. Again, 100% agree with that. It is a trade-off, like I was talking earlier about the liver and kidney stuff with the NSAIDs. It is a trade-off, and it's about what the pet parent feels comfortable with, and it's always going to be a balance. So let's have a look. This therapeutic dilemma is complicated by differing risk perceptions between vets and caregivers. Vets, due to their medical training, may be more comfortable with the risks associated with prescription analgesics, whereas caregivers may be more hesitant, sometimes declining or limiting their use even when deemed necessary by the vet. Again, this is something I see a lot of. Pet parents are frightened to use pharmaceuticals with their dogs. There's a lot of inflammatory stuff on social media, so inflammatory. And I think that to make a sweeping statement that, like, Librela will do this to your dog, blah, 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 like, we get it, right? Okay, it's not the best. That's kind of my two penneth worth. However, in a case of, do we PTS this dog or do we do a few rounds of Librela to, get another 6 months, comfortable 6 months out of the dog? Absolutely, in my opinion. But anyway, so let's skippity dip. So basically they're going to look at case studies, and that's the bit that I want to have a look at. And there was also a really funky table with pictures, which I can really get on board with. I'm really poop. I can't understand these graphs, but I can understand. Aha, okay. So this is the summary of 19 dogs that experienced joint-related adverse events whilst receiving Librela. So this just makes me really sad. So the first dog is just over 2-year-old Labrador Retriever and received 6 doses of Librela. And as you can see, indicated by this symbol here, that dog was euthanized. The key at the bottom shows that we had a serious adverse event. This dog had surgical treatment and what was that word? Sorry, articular fracture. Just over 2 years old. Why was that dog on Librela? Such a young dog, for God's sakes. Again, 2 years old, so young. 9.3, okay. 11.8, 10.2, 10. Yeah, but look, it's 5.8 years old. That's so young. 6 years old. 4 to 5, 7 years old. Look at all the ages of these dogs, sorry. Just makes me really sad. And look at the proportion of them that had those adverse reactions. Now, some of them have recovered. Some of them are still kind of like ongoing, but we had two PTSs, so 2 euthanasias in there. Okay, so these are pictures for the case study. So let me just make my camera a little bit smaller. Okay, so again, I am not a vet. I am not a radiograph technician or anything like that. But I do like looking at imaging. Okay, so picture A, 6 months before starting treatment. Where's the comparison? Is this the same dog? Is it? That can't be the same dog. Is that the same dog? Are you joking? No. No, okay. Wait a minute. It's a different dog. I was going to bloody say, but still. Right, let me go and have a look at this case. So, case 1, a young adult Labrador Retriever. CT demonstrates medial compartment pathology within the right elbow joint. Arrows indicate a medial coronoid process, fissure, and a lesion. There's no evidence of humeral I'm not even going to attempt to pronounce that. Preoperative radiographs obtained after 6 Librela reveal a lateral humeral fracture with subsequent malunion. Post-operative radiographs, severe, developed after 2 injections, persisted despite treatment. 6 months, so that's after, and 9 months after. That's crazy. Oh, look at the little baby. Right, and then number B. See all this fluffy stuff here. I don't know if you can see my mouse, but all of that fluffy stuff is cartilage breakdown, which then calcifies. So when it calcifies, it means that the X-ray can pick it up. So you should have lovely, like, kind of like nice clean line bones, and we don't. Look at all that metal work as well. Oh. Okay, you can see this a bit more clearly, I think. So this is a 3D model from CT. Let's have a look. Case number 4. You case number 4? A and B pre-treatment, 8.5 years old. Non-serious arthritis. But there is arthritis. I don't even know what that means, right? Okay, let me find another kit. Okay, right, well... Jesus Christ. Okay, so 8 months before starting the treatment. So this is a 3D model. And then all of that there, which you can't see my mouse moving, is the arthritic change. Just makes me really sad. So this was a 7.5-year-old Labrador Retriever, post-Librela CT scan. Had, is it revealing attending specialist, VMD, specifying the suspicion. The report was shared and filed for non-serious arthritis with an outcome of recovered or resolving. How can you recover from that? You can't. That's the point. Okay. Oh, Jesus. Again, all of that fluffy stuff. I keep saying fluffy stuff. I'm sure there's a much more scientific way to say that. This is scathing. This is 19 dogs after 16. So this is a 5.5-year-old Labrador Retriever receiving Librela to treat mild elbow dysplasia. Tarsal swelling and hind limb lameness developed. And this was what it looked like after 16 doses. Note the marked bilateral soft tissue swelling. Report was filed because both hocks were clinically normal before treatment and developed severe OA. So you go in to treat elbow dysplasia, and in this case you've come back with severe OA in the hock. Oh my god! Look at the swelling on that. What the hell? Okay, so an 8-year-old English Bulldog was treated with Librela for elbow dysplasia, developed tarsal swelling and hind limb lameness within 3 weeks of the first dose. Radiographs acquired after 2 Librela injections show moderate bilateral arthrosis, which progressed rapidly. Look at the absolute state after 15 Librela injections. Shit. Included the observed pathology because this did erosive immune-mediated polyoarthritis. Oh my god, can you imagine how painful that poor baby is? Jesus. 5 months after starting treatment and then after 20, Librela, it just gets to the point where it's inexcusable. 7 Librela injections. Oh. So that's metalwork that's come out of a dog that has been euthanized or may have passed with from natural causes. 10.5-year-old mixed breed, 7 Librela injections following TPLO, severe joint erosion. Intractable pain, necessitated euthanasia. Poor baby. And septic arthritis were excluded. Revealed findings similar to those reported in human RPOA. Right, where is this part of the conclusion? Let me find the conclusion. Okay. Our study highlights an important weakness in the current pharmacovigilance system. The lack of comprehensive terminology for accurately capturing serious adverse events. Okay, so this, right, here we go. An FDA panelist involved in the adjunction of the humanized anti-nerve growth factor, so human Librela, eloquently summarized our current belief. All parties agree that the use of anti-nerve growth factor, Librela, is effective, but they are associated with a unique, rapidly progressing form of OA, and we can only speculate as to its causes. In animals, just as in people, the goal of effective pain management is paramount. However, we must also ensure that our therapeutic interventions do not inadvertently exacerbate the underlying condition. To uphold the highest standards of care for companion animals, we hope to apply the same rigorous scrutiny to veterinary as was employed in the human healthcare. And then there's all your references there. Now, I wish I could kind of discuss that paper a little bit more eloquently, but I can't because there's terminology that I don't know. I'll have to go away and look at it. But from just if we kind of strip it back to the bit that I could really digest, was the arthritic change on the imaging. That is absolutely horrific, for want of a better word. And I'm so... Is glad the right word? I don't think glad's the right word. I'm so thankful that there has been a review into Librela, because I didn't like it to start with, and I looked to see what Professor Darryl Millis said about Librela. He's essentially like the godfather of rehab, and he said basically he would use it as an absolute last resort. For me and my dogs, like my own dogs, it would be an absolute last resort to use it, and I'd have to think very, very carefully about whether or not I wanted to use it. I think it's been heavily overprescribed. I think it has been prescribed into dogs that are so young, before we've even looked at other pain management options. You know, it's... I've seen it do good things, but I think it's been wildly overprescribed. And that's just my humble opinion. Again, not a vet, just a therapist with a lot of opinions. And I'm thankful that this paper has come out, because now I have a little shield that I can kind of use it to butt at people and say, yeah, but look at this. I think in the coming years there's going to be more research done into Librela. I'd be very surprised if it kind of came off the market, because does it work as an effective pain reliever? Yes it does, but at what cost? Think of that Labrador that, you know, that was 2.5, that had to be euthanized. It should not be used in young dogs. It should not be used in young dogs. It should be... They need to change the way it's prescribed, in my opinion. So it has to be a dog that's got diagnosed osteoarthritis and they've already tried, like, bish bash bosh, however many different drugs, and it's not worked, so then they use Librela. It's like handing out morphine to someone for a stubbed toe. It doesn't make sense. But anyway, that's my 2 penneth worth. Again, that's all it is. It's an opinion. That doesn't mean that if your dog is on Librela, you should take them off straight away. And it doesn't mean that you should never use Librela. It just means just have a little think. Have a look at the research that's out there about it. But with any drug, even with herbs, for God's sakes, you know, have a look and make sure that it's going to be suitable for your dog, because I'm telling you now, if your dog's got severe osteoarthritis, you know, turmeric isn't going to fix it. Nothing can fix it. It's about managing the dog's pain in an ethical and safe way, and I don't think Librela's been prescribed safely in the fucking slightest. But there you go. That's me. If you have enjoyed this video or taken away something from it, please make sure to like, share and subscribe. But for now, lots of love to you and your dogs, and I'll catch you soon. Take care for now. Bye.